Hello, I'm Danielle Marques Oliveira, I'm from Group 1, and today I'll be demonstrating how to take care and position a patient that is mechanically ventilated. So first of all, considering the patient will be intubated, he won't be able to speak anything, right? So for that, you're going to need to create some form of communication with the patient. For example, hello miss, since you have the tube and you won't be able to speak with me, every time that I say something and you understand, you can agree with me by blinking, okay? You understand it? Good. This will be a way, for example. Now, also a very important thing to mention is that since the patients most of the times will be unconscious, they won't be able to move, right? So the nursing assistant and the nurse themselves can move the patient multiple times from like 2 and 2 hours normally. And a very special position would be the Fowler's position, where you bring the patient up, a clutch here, that is around 45 degrees. Some beds will move themselves, others you can just put a pillow if you're doing at home, and then come back to the patient to the position. This will also be of very important attention for any bad sores around the coccyx area, torso, or buttocks. One more thing that's also very important to mention is to keep the patient head to the side, that way you can prevent aspiration from the gastric contents coming back, right? Other things that should be important to mention is that the vital signs should also be checked. The oxygen, blood pressure, everything reported back to the respiratory nurse. Also, you have to check for any other sign of a pressure ulcer in any bony prominence of the body. And lastly, you have to also check for any redness in the insertion of the tube, for example, in skin breakdown or swelling. After all that, it is important also to really assure the patient that he's okay and that he knows the procedure, and also the family. Thank you very much.